Welcome everybody, and thank you for being here this afternoon. My name is Dean Germano. I'm the CEO of Shasta Community Health Center, and this is our chairman of the board, Mr. John DePerry, and our medical director of Shasta Lake, Dr. Elaine Porter, and our dental director, Dr. Franklin Pierce. So this is who we are. It gives me great pleasure to do this today, to recognize our new facility, and I was reflecting on this earlier today, sort of what it took to get us here. And like a lot of things, it took a decade to be a bit of an overnight success, right? The health center up here, and Mr. Dixon, who's from City Council here in Shasta Lake, welcome by the way. We're just talking about somebody who was very instrumental in getting our services up here, and that was Molly Wilson, Supervisor Molly Wilson, of course, who has passed away. And I remember, gosh, it was maybe 12, 13 years ago, she pulled me aside and she said, "Now, Dean, you need to get your services up there in Shasta Lake, you know." And I said, "Okay, Molly, I'll do my best." And you know anything about Molly, she was very persistent in her way, and something I've always appreciated. She really cared deeply about the people she served. And so we started out with a modular building on a piece of property, worked with the city. It was very wonderful. Dr. Porter was our second physician, but really was the one who started all this almost 10 years ago now.
Yeah, it'll be 10 years in September.
So we started out with that, and we actually did an expansion. We started to grow, and then of course we started thinking about a permanent site for our services, or our medical services here. So when we started thinking about it, Molly Wilson pulled me aside one more time and said, "Dean, you need to put some dental services up there, you know. We need dental services up there." And I said, "Okay, we'll try to do that." Marta McKenzie was a part of that as well with public health, and she really wanted to have some presence here as well. And so Ron Lynn with the pharmacy, and we started pulling together this coalition. And coalitions are really hard to put together, trust me. But we had the right people together. The city was absolutely wonderful. They pulled together a lot of grant dollars that helped us to build this place, and we built it with some shelled-in space, 2,500 square feet. We were determined to get a dental program here. Dr. Porter continued to remind us, "Dean, my patients need dental services up here." So we tried to keep the promise to Molly and to others in the community. I have to say thanks to our board, because if you know anything about being on a board of a nonprofit, and particularly a health center, you have to have a lot of faith, right? Never sure the money's going to come in. You got to have that sense of mission and purpose, and then they got to be on top of us to make sure we get the business part of it done too. But the mission is very central to what we do here, and I'm so proud of what we've created here. The staff. We have a wonderful staff on the medical side. We've developed a wonderful staff on the dental side. We work well with our partners in public health and Ron's staff next door, and I think the community is being well served and will continue to be well served. I hope this legacy lasts for a long time, and these little kids that we're seeing today will grow up, you know, into adults, and will remember their experiences and carry this with them and have that sense of service and purpose and mission, and have a very healthy and successful life. That's our goal here, to serve this community and to have that be accomplished. So, having said that, I'd like John and I, now this is my birthday present, by the way. My staff said they were thinking about what could they get Dean, and they brought this out to me, and at first I thought they were going to do something to me, but they're quite impressive, don't you think? So John and I are going to try to cut the ribbon here at the top and the bottom.
Dr. Pierce and Porter, can you move in a little bit?
All right, we'll do this together. And so, John, you want to say something if we got the ribbon? No, I did it.
Congratulations, glad it's here.
Okay, so
Wow.
Thank you. Susan's made some great hors d'oeuvres. Please take advantage of them. They're first rate. So come on in again. Don't